Let's talk about a topic that's often whispered about, or worse, ignored: your intimate health and vitality after 60. If you're a man and you've noticed annoying leakage, decreased sensitivity, or even pelvic pain after a moment of solitary intimacy, you're not alone. And most importantly, it's not just age. You may be making subtle but profound mistakes that are silently sabotaging your physical and emotional well-being. And believe me, most of the men I talk to are completely unaware that they're making these errors. I'm Dr. Elena Castillo. Throughout my career, working with thousands of older men, I've learned that taboo and guilt are more harmful than the act itself. But the truth is, as we age, the way we care for our bodies during intimacy must change drastically, especially if we want to protect our prostate, urinary control, and overall quality of life. My promise today isn't to talk about morality, but about anatomy, connection, and longevity. Today, my mission is simple: to bring this topic out of the shadows and offer you practical, compassionate wisdom. We're going to review the 7 most common and subtle self-touch mistakes after 60, mistakes that urologists see daily and that you can correct immediately. Let's start with the first, and perhaps most frequent, mistake that men report to me, often due to the ease and privacy it offers. Mistake 1. Intimate touching on the toilet or in a compression position. I know it seems like the most discreet or convenient place for many, but anatomically and physiologically, it's one of the worst scenarios for your body after 60. Let me explain the mechanics. When you sit on the toilet, your body is in a position designed to relax the sphincters and facilitate bowel movements, not for pelvic blood flow or healthy erotic stimulation. By adopting this posture, you're putting significant pressure on the perineum, that key area between the scrotum and the anus. Think of the perineum as the nerve center of your lower anatomy. It's where crucial nerves and blood vessels converge, supplying both the prostate and the penis. This constant compression, repeated over the years, has direct consequences. First, it restricts the essential blood flow the region needs for a full response and for recovery after intimacy. Second, and more seriously, it directly compresses the prostate. The prostate is already susceptible to inflammation with age, due to common conditions such as benign prostatic hyperplasia, or BPH. Subjecting it to direct pressure during arousal, a time when it is already engorged with blood, dramatically increases the risk of inflammation, prostatitis, and can contribute to the development of chronic pelvic pain. Furthermore, this toilet position unnecessarily strains the pelvic floor. If you already experience that bothersome post-void dribble, drops that come out after you've finished urinating, or feel you need to strain to completely empty your bladder, this intimate practice will aggravate those symptoms. The pelvic floor is being overloaded at a time when it should be relaxed or working in a coordinated manner, not under undue tension from positional compression. Many men describe a feeling of bloating, heaviness, or even a slight burning sensation after masturbating in this position. This is due to venous stasis, the pooling of blood, and the local inflammation that the compression induces. In the long run, the most insidious danger is the silent damage to pelvic neuropathy. Repeated compression can subtly affect the dorsal nerve of the penis, which is vital for sensation. This can lead, over time, to a noticeable decrease in sensitivity or, in extreme cases, to erectile dysfunction caused by nerve damage. It's cumulative damage, too high a price to pay for the convenience of momentary privacy. The practical solution is simple, and the difference in well-being is immediate. Change your environment. Seek positions that promote relaxation and blood flow. Opt for a lying position, on your side, or even sitting in a comfortable chair where your weight is properly distributed over your ischial tuberosities, the bones of your pelvis, completely relieving pressure on your perineum. This not only protects your vital structures, the prostate, the pelvic floor, the nerves, but also improves the quality of your intimate experience, allowing for a complete and healthy physiological response. Intimate health should be an act of care, not compression. Let's move on to the second mistake, which has to do with the choice of lubrication and stimulation tool. Let's get back to our focus. Mistake number 2, and perhaps the most fundamental in terms of long-term performance and feel, is ignoring the pelvic girdle. It's a concept often relegated solely to women's health or incontinence problems in older men, which is a serious oversight. The pelvic floor, that network of muscles running from the pubis to the coccyx, is the true hidden engine of your intimate function. It directly controls three vital aspects: the quality of erections, through compression of blood flow, the intensity of orgasms, through rhythmic contractions, and, of course, urinary control. When we ignore it, or manage it poorly, the consequences are profound. There are two common faults that I observe. The first is weakness, and the second is hypertonia, excessive tension. When there is weakness, the analogy I use is that of a leaky dam. The ischiocavernosus and bulbocavernosus muscles, which are part of the pelvic floor, are designed to trap the blood entering the penis, maintaining the necessary rigidity. If these muscles are weak or underactive, no matter how strong the blood flow, the erection will not be able to be sustained firmly. The result is a prostate that loses muscular support and a lower quality erection, forcing the body to compensate in inefficient ways, such as increasing tension in the wrong areas or relying excessively on external physical stimulation. Hypertonia, or chronic tension, is just as damaging. Many men, especially those under chronic stress or with performance anxiety, walk around with their pelvic floor permanently tense. They believe that holding in I is always better. But imagine trying to flex your biceps for 8 hours straight. The muscle fatigues, shortens, and eventually refuses to function properly. A constantly tense pelvic floor restricts blood flow to the penis and the prostate gland. This chronic tension can be a crucial underlying factor in the development of conditions such as premature ejaculation, where the muscles are so exhausted that they contract spasmodically and uncontrollably, or, paradoxically, difficulty reaching orgasm, anhedonia, since the ability to rhythmically relax and then contract the muscle is lost. The solution isn't simply doing 1,000 random Kegel exercises. That's an oversimplification and sometimes counterproductive. The key lies in conscious control, which involves both activation, contraction, and complete release, relaxation. It is imperative that we incorporate pelvic floor awareness into our intimate health routine. During masturbation or sex, are you actively engaging your hidden engine, or are you simply letting your body function on reflex while you focus solely on external stimulation? Let me tell you Ricardo's story. Ricardo was a 45-year-old lawyer, very successful, but frustrated by a progressive decline in the firmness and intensity of his orgasms. He had been diligently performing Kegel exercises, squeezing tightly, but confessed to me that he felt a break or dull ache in his perineum. Upon examination, we realized that Ricardo had an incredibly tight pelvic floor. He had mistaken strength for rigidity. He was blocking his pleasure. We worked on myofascial release techniques and diaphragmatic breathing exercises that focused on deep relaxation of the pelvic area, before moving on to the activation phase. In just 6 weeks, Ricardo reported not only a dramatic improvement in firmness, but also an explosion in sensory quality. He had unlocked the flow, allowing the engine to work efficiently. Understanding your pelvic floor is empowering. It means you have an internal tool, under your control, that can modulate your sexual response. The next time you feel aroused, pay attention to that area. Notice if it's tense from anxiety or relaxed and ready to engage. Control isn't just about squeezing, but about knowing when to release. Understanding your pelvic floor is empowering. It means you have an internal tool, under your control, that can modulate your sexual response. The next time you feel aroused, pay attention to that area. Notice if it's tense from anxiety or relaxed and ready to engage. Control isn't just about squeezing, but about knowing when to release. Now, let me address the psychological root of much of this tension we've been discussing. Error. 3. Apressar a experiencia. This is perhaps the most insidious mistake in our modern efficiency-obsessed culture. Many people, under the pressure of time or accumulated stress, treat self-pleasure or sex as a quick task, an urgent release of tension, a box to tick to, let loose, and get on with the day. What is the cost of this haste in the context of sexual response? When you seek immediate and rapid gratification, the central nervous system interprets this speed not as pleasure, but as tension and urgency. The sympathetic nervous system, our fight or flight system, designed to respond quickly to danger, is activated. This is diametrically opposed to what we need for deep and satisfying pleasure. For pleasure to be nourishing, we need to activate the parasympathetic system, the one that allows us to rest and digest, and, crucially, to feel and connect. The body doesn't lie. When we rush intimacy, we're depriving our system of the full hormonal reward. Think of oxytocin, the hormone of bonding and deep well-being, and dopamine, the hormone of seeking and pleasurable anticipation. These molecules require saturation time. If you rush to climax in just a few minutes, you get a quick dopamine release, a spike. But there's no time for oxytocin to build up and settle in your system, anchoring the experience in your brain as something safe, profound, and restorative. It's like trying to fill a pool with a garden hose in 10 seconds. There's a squirt, but no fullness. The message we are sending to the body and brain is devastating in the long term. Pleasure is superficial, brief, and must be achieved under pressure. Over time, this pattern teaches the body to lose sensitivity. The system becomes accustomed to operating under tension to achieve pleasure, requiring a stronger, more direct, or more novel stimulus to feel the same. It's the perfect recipe for progressive sensory desensitization and the so-called peak pleasure that leaves a lingering feeling of dissatisfaction. Let me introduce you to Clara. Clara, a 30-year-old professional, came to see me because she felt her orgasms were hollow, despite being frequent. She masturbated almost daily, always in the same way. High-friction stimulation, concentrated on the clitoris, with the goal of finishing in less than 5 minutes before her next Zoom meeting. She confessed to me, "I do it to relieve stress, but I don't feel truly satisfied. It's just physical release. There's no joy." Clara's problem wasn't technique, but intention and speed. Her mind wasn't in her body, it was on her to-do list. Her nervous system was activated by anxiety, not sensory curiosity. She was training her body to associate pleasure with haste. The solution lies in intentional deceleration, or what we call the practice of expanded time. It's not about forcibly timing more minutes, but about expanding felt time through conscious presence. For Clara, the change began with a simple rule. The first 10 minutes of any self-touching experience should be dedicated exclusively to breathing and sensory mapping. Zero focus on orgasm. Gently touch non-genital areas. Notice the temperature of your skin, the texture of your hand. If your mind wandered to your to-do list, gently redirect it to the smallest sensation you could find in your pinky finger. Haste kills sensation. Slowness amplifies it. By removing the pressure of the goal, Clara allowed her parasympathetic nervous system to take over. Only then, when the body feels safe and cared for, can that full and pleasurable surge of oxytocin occur. The goal becomes the sensory process, not the end result. While Clara struggled with excessive sexual activity driven by anxiety and the need to check a box, there's an equally damaging problem at the opposite end of the spectrum: infrequent sex, often motivated by guilt, cultural shame, or, sadly, simple disinterest and routine. It's here that the absence of conscious touch becomes a serious problem for long-term sexual and systemic health. Think of your sexual system not as an on-off switch, but as a complex circulatory network and a tissue ecosystem. It's a structure that demands constant flow. If the river flows regularly, the surrounding ecosystem is vibrant, the water is clear, and nutrient circulation is optimal. If the river stagnates, for months or years, the water becomes murky, life withers, and, worse, the flow path is forgotten. When self-gratification is seen as a dispensable luxury, as an activity that one should be ashamed of, or as a mere biological reflex that must be repressed, the body is denied a fundamental need for circulation and tension relief. Chronic disuse sends an unmistakable signal to the brain and erectile and pelvic tissue. This function is no longer a priority for survival or well-being. This is the biological law of use it or lose it. In the physical context, stagnation can increase inflammation. In the neurological context, the lack of nerve stimulation and blood flow leads to a gradual loss of responsiveness and, ultimately, to atrophy of desire. It's a self-fulfilling prophecy. Shame leads to abstinence. Abstinence leads to loss of sensation, and loss of sensation reinforces the idea that the activity isn't worth it. I have worked with patients who, after years of self-imposed repression, or repression due to external factors, literally had to relearn what pleasure felt like, because the nerve pathways had become silent or sluggish from disuse. The body has memory, but that memory requires periodic and loving reminders. So, where is that ideal balance? The number we suggest, once or twice a week, isn't a rigid prescription to be followed to the letter, but rather a point of reference for establishing regularity without obligation. The key lies not in the math, but in the awareness copper with which you approach that rhythm. The ideal frequency is the one that allows you to achieve 3 essential goals without falling into compulsion. 1. Release of accumulated tension, allowing nervous energy and pelvic tension, inevitable in modern life, to be released safely and healthily, preventing them from becoming somatized anxiety or chronic pain. 2. Maintenance of the nervous and muscular pathway, ensuring that the muscles and nerves involved in the sexual response are exercised and maintain their responsiveness. This is preventative maintenance of the system. 3. Conscious interconnection, serving as an anchor for self-knowledge and body respect. It is a sacred moment where one allows oneself to receive pleasure without having the obligation to respond to anyone else. If the frequency is too low, the body forgets how to feel. If it's too high and driven by fear or boredom, the body becomes exhausted and the experience is emptied of meaning. The real solution, therefore, lies not in the meter, but in the why and how of each encounter with oneself. We are seeking a frequency that is rhythmic and respectful, not a compulsive frequency or a guilt-ridden absence. To achieve that healthy rhythm, it's crucial to address the 5th common mistake, which is closely linked to intention. We've explored common mistakes, understanding that self-pleasure is an essential act of maintenance, not something to be ashamed of or compulsed by. Remember, the goal isn't the perfect frequency, but rather the awareness and respect with which you approach that rhythm, seeking tension release and interconnection as pillars of your well-being. I'd like to know, what's the first step you'll take this week to make your self-pleasure a truly conscious and respectful act? Share your thoughts in the comments. If this discussion resonated with you, please subscribe to the channel, turn on notifications so you don't miss the next analysis, and share this knowledge with anyone you think might need it. I deeply appreciate your time and trust. Until next time, take care and honor your body. I'm Dr. Elena Castillo,